Hi, Ruben here and welcome to Anatomy Movement, where anatomy becomes funatomy. We have summarized and detailed notes, acronyms, HD images to build your photographic memory, X-rays images, tabled notes and questions and answers at the end of each video to help you remember all that we have learned. Without further ado, let's dive into today's topic. The lymphatic drainage of the upper and lower limbs. In lymphatics you are expected to capture the following. 1. Lymphatic vessels of the lower and upper limb, plus their branches. 2. The lymph node groups of the upper and lower limb. 3. The clinical relevance of the nodes. 4. Understand the content and answer the tricky questions that we have set for you in this video correctly. And finally 5. Be kind enough to hit that subscribe button even as we get started. We'll begin with the lower limb where we shall discuss the lymphatic vessels and the lymph nodes. The lymphatic system functions to drain tissue fluid, plasma proteins and other cellular debris back into the bloodstream, and is also involved in immune defense. Once this collection of substances enters the lymphatic vessels it is known as lymph. Lymph is subsequently filtered by lymph nodes and directed into the venous system. Lymphatic vessels. The lymphatic vessels of the lower limb can be divided into two major groups, superficial vessels and deep vessels. Superficial lymphatic vessels. The superficial vessels can be divided into two major subsets. 1. Medial vessels, which closely follow the course of the great saphenous vein. This group of vessels ends in the groin, draining into the subinguinal group of the inguinal lymph nodes. 2. Lateral vessels which are more closely associated with the small saphenous vein. Deep lymphatic vessels. These are far fewer in number than their superficial counterparts and accompany the deep arteries of the lower leg. They are found in three main groups: anterior tibial, posterior tibial and peroneal, following the corresponding artery respectively, and entering the popliteal lymph nodes. Lymphatic nodes. There are two nodes in the lower limb: inguinal nodes and popliteal nodes. Inguinal nodes. The inguinal nodes are found on the upper aspect of the femoral triangle and are 1 to 20 in number. They are subdivided into two groupings. A horizontal line is usually drawn to separate the two. Those below this line are the subinguinal nodes, which consists of a deep and a superficial set, while those above are the superficial inguinal nodes. Popliteal nodes. They are often found embedded in fat reserves in the popliteal fossa. Clinical relevance. Lymphadenopathy. Lymphadenopathy is characterized by an abnormality in size, number or consistency of any lymphatic nodes within the body. This is usually in response to infection, malignancy or an autoimmune condition. It's also important to note that injury to the small toe would cause swelling at the popliteal nodes while injury to the big toe would cause swelling at the inguinal nodes. Now let's have a quiz. The medial superficial lymphatic vessels of the leg travels with which vein? Small saphenous vein, great saphenous vein, anterior tibial vein, fibula vein. The correct answer is great saphenous vein. Lymphatics of the upper limb. Here too, we shall look at the lymphatic vessels and the lymphatic nodes. The lymphatic vessels of the upper limb are divided into superficial and deep, just like the lower limb. Superficial lymphatic vessels. The superficial lymphatic vessels of the upper limb initially arise from lymphatic plexuses in the skin of the hand. These vessels then travel up the arm in close proximity to the two superficial veins of the hand, that is, cephalic and basilic veins. Deep lymphatic vessels. The deep lymphatic vessels of the upper limb follow the major deep veins, that is, radial, ulnar and brachial veins. They terminate in the humeral axillary lymph nodes. They function to drain lymph from joint capsules, periosteum, tendons and muscles. Lymph nodes. The majority of the upper extremity lymph nodes are in the axilla. They can be divided anatomically into 5 groups. Pectoral or anterior nodes. 3 to 5 nodes, located in the medial wall of the axilla. They receive lymph primarily from the anterior thoracic wall, including most of the breast. Subscapular or posterior nodes. 6 to 7 nodes, located along the posterior axillary fold and subscapular blood vessels. They receive lymph from the posterior thoracic wall and scapular region. Humeral or lateral nodes. 4 to 6 nodes, located in the lateral wall of the axilla, posterior to the axillary vein. They receive most of the lymph drained from the upper limb. Central nodes 3 to 4 large nodes, located near the base of the axilla, deep to pectoralis minor, close to the second part of the axillary artery. They receive lymph via efferent vessels from the pectoral, subscapular and humeral axillary lymph node groups. Apical nodes located in the apex of the axilla, close to the axillary vein and first part of the axillary artery. They receive lymph from efferent vessels of the central axillary lymph nodes, therefore from all axillary lymph node groups. The apical axillary nodes also receive lymph from those lymphatic vessels accompanying the cephalic vein. You should be in a position to sketch the nodes of the upper limb. Clinical relevance. Axillary lymphadenopathy. Axillary lymphadenopathy refers to enlargement of the axillary lymph nodes. Let's have another quiz. The deep lymphatic vessels of the upper limb terminate in which lymph node group? Cubital, axillary, brachial, deltapectoral. The correct answer is axillary. Thanks for watching. Please ensure you hit that subscribe button so that you can benefit from more videos in the future.